Okay, let's unpack this. We often have this intuitive belief, don't we, that public health stuff is always good for the environment too. A real win-win.
Yeah, exactly.
Things like getting people cycling or maybe taxing unhealthy foods. It just feels right for both us and the planet.
Hmm.
But what if that's not quite the full picture? What if some things that make us healthier might actually, well, add to our environmental impact?
And that's what's really disruptive here. There's a recent paper that basically challenges that whole assumption.
Right.
It kind of forces us to take a harder look and ask, are these health efforts always aligned with sustainability, or could they sometimes pull in opposite directions?
So that's really our mission for this deep dive then, to explore what this research says it actually takes for a public health intervention to be genuinely environmentally sustainable.
Hmm. It's a crucial question.
So, okay, we usually focus on the immediate effects, right? Like less pollution today. But this paper argues for a much, much longer view. It talks about looking at the impact over, well, over a whole human life.
Exactly. It's called the human life cycle perspective. So instead of just the short term, you consider all the environmental impacts. Everything from, say, the raw materials used in things we consume, right through to disposal.
The whole shebang.
The whole shebang, across a person's entire life. So think about that tax on animal fat you mentioned.
Okay.
It might cut farming emissions now, improve health outcomes, that's good.
Right.
But if people live healthier, longer lives as a result,
They consume more stuff over more years.
potentially, yes.
Yeah.
They consume more resources over that extended lifespan, which could actually increase their total lifetime environmental footprint.
Wow. Okay, that's counterintuitive. Like take anti-smoking campaigns.
Right.
Massively successful, great for health, people live longer.
Undeniably good for health.
But this research suggests those extra years of life could mean, while a bigger accumulated environmental impact overall, it's suddenly not so simple.
It really isn't. And that ties into a bigger concept the paper raises. Environmental budgets.
Environmental budgets, like a planetary allowance.
Sort of, yeah. Sustainability isn't just about choosing option A because it's less damaging than option B. It's about staying within absolute limits, these safe operating spaces our planet has. A finite budget, if you will.
Okay, so if the planet has this budget, how does that relate to us as individuals and our health choices?
Well, the idea is an individual is sustainable only if their total lifetime environmental impact stays within their fair share of that global budget.
Their assigned share.
Exactly. And a public health intervention is only truly sustainable if it helps the people it affects stay within their share on average, or at least, significantly reduces how much they go over budget.
Which leads to a really fascinating and probably tricky question.
Definitely tricky.
How do you assign those shares? Do we each get like one fixed environmental allowance for our entire life? Or maybe we get, I don't know, a new top-up each year we live?
That's the million-dollar question, isn't it? The paper actually argues pretty strongly against the idea of getting bigger shares as you age, like those annual top-ups. It leans towards the share-for-life model.
Right, the share for life. But why? Because honestly, getting a bit more each year kind of feels, well, it feels more logical on the surface maybe.
Yeah.
What's the argument against it?
There are two main arguments presented. First, it's about maximizing health within those fixed environmental limits.
Okay.
The thinking is our younger years generally have a higher health-related quality of life. Fewer chronic illnesses, more vitality, maybe more of those, really vivid life moments.
Yeah, makes sense.
So assigning one share for the whole life tends to prioritize resources toward enabling those healthier, arguably higher quality years.
Yeah.
Giving out equal shares every year, including to older, potentially less healthy years, is seen as, well, less efficient in maximizing overall population health within the budget.
I see. So it's an efficiency argument regarding health quality. What's the second reason?
The second is about fairness. It brings in something called the fair innings argument.
Fair innings, like in cricket.
Sort of, yeah, the concept. It suggests we should perhaps give priority to helping people reach a normal span of life in good health, especially those who haven't had that chance yet.
Ah, okay. Prioritizing the young or those who haven't lived a full life yet.
Exactly. So allocating one environmental share for a whole life aligns better with that principle. It prioritizes enabling a full, healthy life from the start, rather than giving sort of equal environmental weight to every single year of life, regardless of age or health, which is what annual shares might imply.
So putting it all together, the really big takeaway here is We just can't assume that making people healthier automatically helps the planet. It's not always a simple win-win.
Not at all.
Some interventions might actually push us as individuals further into environmental debt over these longer, healthier lives we might live. It really challenges our basic assumptions.
It absolutely does.
Yeah.
And given that, let's face it, many of us, particularly in the developed world, are already living way beyond our sustainable environmental share.
We're already over budget.
Right. So a successful public health measure that extends life essentially forces a choice. Either we drastically cut back on other kinds of consumption, travel, goods, energy, or we have to make everything we consume dramatically more environmentally efficient.
Otherwise, the health gain just digs us deeper into that environmental overdraft.
Precisely.
So here's a final thought for you, listening right now, to maybe mull over. If living longer, healthier lives is something we strive for, but this research highlights a potential environmental cost.
Yeah.
How do we, collectively, find the necessary environmental savings to make that longer, healthier life truly sustainable for everyone, both now and for future generations?